So I want to go back to a point that Dr. Gandhi raised earlier, and that is that the commitment to patient safety can't stop when someone leaves the hospital or the doctor's office. Many people come home with a prescription, or in some cases with several prescriptions, and they have to manage them on their own. But unlike something as basic as aspirin, almost none of these prescriptions come with standardized, regulated, consumer-friendly instructions. This is a huge hole in our patient safety system. It has real consequences. In 2010 alone, the Centers for Disease Control found that more than 15,000 people died from unintentional prescription drug overdoses. That's entirely preventable, in my view, and entirely unacceptable. So, Dr. Gandhi, let me just start with you on this. Can we assume that at least some of these overdoses have been caused by people who don't understand how properly to take their medications?
I think that's a very valid assumption.
Okay, good. Then let's go to the second part, and that is, would you conclude that in addition to the thousands of people who die from unintentional medical overdoses each year, there are probably many more people who are taking their medications improperly because they don't understand the instructions?
Well, there's very good data to say that patients are often not taking medications as they were originally prescribed. Now, there can be a lot of reasons for that, one of which might be they don't understand, one of which might be it's really expensive and they decide, well, maybe if I take half a pill instead of one, I'll still be okay. I mean, there's lots of reasons for that, but I think lack of understanding of how to take the medicine, what it's for, what the potential side effects are, all of those are significant issues in the ambulatory setting.
Anyone else want to weigh in on this? Ms. McCafferty?
Well, Consumer Reports has spoken before Congress recently, within the last 6 months, I think, on the need to improve labeling and information to patients. It's a critical issue, and I think it's something that Congress can do something about.
Good. Dr. James?
Yeah, I knew two parents, well, who lost young adult children to overdose of medication. What happens is often these are opioids and they're very addictive. And a lot of doctors don't understand the power of the addiction for these patients. So they get a prescription, or if they don't get what they want, they can go to another pain mill and get these. And so there's kind of, the system needs to be fixed so that that cannot happen, so these young adults don't die.
Dr. Dish?
This is another good example of an issue that really does require patients and family conversations about the drugs, not just prescribing and saying, here's what we're going to put you on, because there may be information that the patient or family has that this isn't a good drug, or I've taken it before, or there's a story where a patient was ordered to change his diuretic and to weigh himself and come back in a couple of days if he gained more than 3 pounds, and great education, but the patient was homeless and didn't have a scale. And so the discussion about, is this going to work for you? What are the goals? And really personalizing even something that seems as straightforward as a medication prescription really requires talking with the person and not just prescribing for.
Dr. Jaw?
So, we've seen this happening, I think, in lots of other areas where we now have, we've changed the way we were labeling food. I mean, you can put lots of data out there, but if it's confusing, it's worse than not having any information at all. And so obviously we've seen progress in this. There's been a lot of very good work to start pointing to what is the kind of information you need to show patients, how do you present it in a way that people can understand. This is not rocket science. People have done the work on this, and this is a place where I would think the FDA, and again, this is a little beyond my area of expertise of who does the regulating around this, but it seems to me that this is something that we have a clear role on to make the information much more consumer-friendly so normal people can understand it.
Good. And Dr. Gandhi?
So I want to reiterate what Dr. Dish said. I agree that a label alone will not solve this problem. It's a part of the problem, but it's really having those really good conversations with patients about medication. But the other piece, too, is giving providers the tools to have those good conversations. So these patient-friendly tools, electronic medical records, for example, could really help to provide a nice calendar to a patient of here's what you take and why and what days and so on. So I think there's tools that we need to give to providers to help these conversations really go well.
Good. Well, so I very much appreciate the point on this, but I'm going to summarize it this way by saying it's clear that there are dangers associated with improper medications. It's also clear that we have consumer-friendly labels for over-the-counter drugs, Tylenol, cough syrup, and that we do not yet have those on prescription drugs. And so what I'm hearing the panel say is that we won't solve everything by getting better labels, but that if we had more consumer-friendly labels on prescription drugs, this is one of those kind of like washing hands. It's at least a low-cost, simple, direct way to make an improvement in patient safety that could save lives and certainly save people who've suffered. I just want to say on this one, the Food and Drug Administration has been working on getting consumer-friendly labels for more than 30 years, and we still don't have them. So this is an area where I think we should continue to push, and particularly continue to push the Food and Drug Administration. They have the authority to do this. We need to have patient-friendly labels on prescription drugs. Thank you, Mr. Chairman.